Hi friends, welcome to TheVedaStation. Today we have Dr. Dhruv with us, who is a neurosurgeon. Just a question to you. Did you ever think कि आप एक वॉच पहनोगे और उससे आपकी स्लीप साइकिल डिटेक्ट हो जाएगी? Did you ever think कि कभी हम वॉच पहनेंगे और वो हमारी लाइफ भी सेव करने की ताकत रखता होगा? This is something which we never expected or explored before. बट आज डॉक्टर ध्रुव से हम समझने की कोशिश करेंगे कि कैसे ये टेक हमारी जिंदगी को एक नई दिशा दे सकते हैं एंड what is the role that neurosciences play in our life. So Dr. Dhruv, welcome to the show.
Thank you.
So doctor, firstly I would like to understand आपकी जर्नी कहाँ से स्टार्ट हुई? You belong from Delhi or you came to Delhi in early time? कैसे स्टार्ट हुआ?
Yeah, so I can say I'm truly a Delhiite only because I was brought to Delhi when I was 6 months old.
Okay.
And because my father was a doctor, both my parents were doctors and they were posted in Delhi and their work was in Delhi. So the entire family, we came to Delhi. Then I studied in Delhi. I did my schooling, graduation, post-graduation, super specialization, and all those things in Delhi itself. My neurosurgery that I think we're going to talk about more is primarily basically from All India Institute of Medical Sciences, Delhi. Then I have trained abroad also in UK, in the Queen Elizabeth Hospital, Birmingham. I was there for minimally invasive brain and spine surgeries, and in various other countries like Germany, Singapore, short stints here and there of learning, trying to harness newer skills. So that's what it's been.
And how did you plan to take actually neurosciences as your specialization while you were a medical student?
Okay, why was I a medical student? I never had doubts that I'll become a doctor. So I'll tell you why. My grandfather was a doctor. Both my parents, my uncle, my sister, they are doctors. So, and it was something very fascinating. The human body is a very fascinating, a very complex thing. And I was always intrigued by the way the human body behaves, reacts to various circumstances, situations, and otherwise also. How from a single cell you develop into a human being, which is remarkable. I don't think there is any miracle which is greater than the human body, the how it develops. So I ventured into medicine because of that. Now, getting interested in neurosciences is by chance, and I think I consider myself fortunate to have taken up neurosciences because I think neurosciences is not just brain and spine, it's not just cells and nerves. It has a beautiful thing attached to it, which is the mind. And they are so linked, they work in proper harmony with each other, you know. So, after my MS in general surgery, I was posted in neurosurgery, and that is when I got exposure of neurosurgery. And I found it so interesting, so difficult, so challenging, and at the same time so logical. So if you understand the basics of neurosurgery, you practically can understand everything about the brain and mind. So that is from where the journey started, and by God's grace, got selected at AIMS, and I took it up, and it's been a wonderful journey ever since.
फैमिली में सबके सब डॉक्टर्स हैं तो आप लोग टेबल पे बैठकर भी यही बात करते हो क्या? कौन सी सर्जरी, कौन सा टूल आज मैंने इस्तेमाल किया?
So yeah, even my wife's doctor, she's a gynae. And my kids are budding doctors, so they're studying
And
medicine.
your mom and dad are also doctors.
Yeah, my dad's no more. I lost him in 2001, but mom's there. Both of them are doctors. So no, we generally do not talk about this because there's so much more to life, firstly, than just the profession. Yeah, but as and when if we encounter something interesting in medicine, like if I have done a challenging case or if I saw a patient which was interesting, or if she had a case which was very interesting and fascinating, we will discuss it out. But
So
not
किस
every time.
तरीके के cases आते हैं आपके पास when you talk about neurosurgery specifically? So what is the problem that a person is actually referring to, and how do you actually identify कि इसको neurosurgery की जरूरत है? क्योंकि अगर हम लेमन में बात करें तो हमें पता ही नहीं होता है, हम सिर्फ फिजिशियन के पास भागकर चले जाते हैं, हमें पता ही नहीं होता है कि न्यूरोसर्जन के पास जाना है. सो गायनिक इज समथिंग दैट पीपल आर स्टिल अवेयर अबाउट,
मैं
बट न्यूरोसर्जन इज टोटली अ डिफरेंट थिंग. एंड बहुत लोगों को नहीं पता होता कि इस पर्टिकुलर डिजीज के लिए या कुछ डिस्कम्फर्ट भी अगर वो कर रहे हैं तो इसके लिए उनको एक न्यूरोसर्जन के पास जाने की जरूरत है, या फॉर एग्जाम्पल एक न्यूरोसाइंस साइंस के डॉक्टर से रेफरेंस की जरूरत है, कंसल्ट की जरूरत है. सो हाउ डू वी define that?
सो देखिए, आई थिंक though many people say that the Indian healthcare system is not so good, but I think it is pretty good. You know, we have a general physician. We still, I see a lot of people who still have faith in their physicians, who their first point of contact is a physician who kind of tries and understand their problems, and then he decides that whether he himself can treat or does the patient needs to be sent to a specialist or a super specialist. So like for every headache, you wouldn't go to a neurosurgeon or a neurophysician. You may just take a crocin and see, if it subsides. If it doesn't subside, then you would go to a physician. Then he'll check your blood pressure and blood sugars and all, rule out all those causes. It just might be a simple migraine. For that, even a physician or a neurophysician or a neurosurgeon, all of them can treat. But when you have symptoms which are persistent, which are more than the normal, like if you have a headache, so which is more than the normal that you generally have, which is not responding to the medications that are being given to you, and you don't have any ascribable reason for that headache, I think that should prompt you to a neurophysician or a neurosurgeon. Or you have a backache which is persistent, of long duration, if it is associated with some weakness in the leg or in the arms, or some numbness, or tinglings, or headaches with vomitings, with visual obscurations, अगर vision में कोई problem आ रही है, आपका एक अंग जो है, एक भाग वीकनेस आ रहा है, उसमें ताकत नहीं है, सुनपन हो रहा है, दौरे आ रहे हैं, इफ यू हैव सीजर्स, these are warning signs. Then you should definitely consult a person from the neurosciences, whether a neurophysician or a neurosurgeon. So बाकी जो केसेस जो जो आते हैं हमारे पास, हेडेक्स के भी आते हैं, एपिलेप्सी फिट्स, दौरे जिनको कहते हैं मिर्गी के दौरे, उसके भी आते हैं, ब्रेन ट्यूमर्स हो गए, ब्रेन इन्फेक्शंस हो गए, meningitis, encephalitis, then head injuries, strokes, whether it is hemorrhagic stroke or an ischemic stroke, then spine, cervical spondylosis, गर्दन का पेन, जो spondylosis, backaches, slip disc, spine की टीबी, spine के infections, spine के tumors, trauma in the spines, plus the peripheral nerves.
What do we mean by trauma in the spine?
जैसे एक्सीडेंट में रीढ़ की हड्डी की नस दब गई, if there is a trauma to the spine,
Okay.
that can happen.
Okay.
The vertebra can get collapsed, the vertebra
Okay.
can get fractured,
Okay.
the spinal cord can get dissected, a complete transaction of spinal nerve, spinal cord, all these things can happen. कोई
Okay.
fall from the height, अभी तो इतना नहीं होता, बट गांव में काफी लोग जो होते हैं वो पेड़ से गिर जाते हैं,
अच्छा.
and especially in the early childhood. So they land up with cervical spine injuries, injuries in the neck, or injury in the back,
Okay.
or lower back. All these things are traumas.
तो हम डिफरेंशिएट कैसे करते हैं कि ये न्यूरो फिजिशियन इज फाइन एंड दिस पर्सन शुड एक्चुअली रेफर टू अ न्यूरोसर्जन, एंड आप किस बेसिस पे उसको सेग्रीगेट करते हो?
Consider there is a patient who comes to you with headache. All right. अब हेडेक जो है वो एक आम तौर का जो हेडेक है वो भी हो सकता है, टेंशन हेडेक्स हो गए, माइग्रेनस हेडेक्स हो गए, हाइपोग्लाइसीमिक, अब अगर खाना नहीं खा रहे हो, फास्टिंग में आपने मे बी यू हैव नोटिस मेनी टाइम्स आपको सर में हेवीनेस सी हो जाती है, यू फील अ लिटिल आउट ऑफ सॉर्ट्स एंड ऑल दोस थिंग्स. सो ये वाली चीजें जो हैं ये जनरली न्यूरोफिजिशियन हैंडल करता है. बट हेडेक कैन बी अ सिम्टम ऑफ अ ब्रेन ट्यूमर, इट कैन बी अ सिम्टम ऑफ हाइड्रोकेफेलस. हाइड्रोकेफेलस इज कि आपका, हम सबके ब्रेन में पानी होता है, ठीक है, और रोज हमारा ब्रेन अप्रोक्सीमेटली ½ लीटर पानी बनाता है और वो निकलता है. इस पानी को हम कहते हैं CSF, cerebrospinal fluid. Now why is CSF necessary? CSF maintains the homeostasis of brain. उसका नॉर्मल फंक्शनिंग जो है वो CSF मेंटेन करता है, और हमारा ब्रेन जो है वो फ्लोट करता है. स्कल इज हार्ट, और ब्रेन इज अ वेरी सॉफ्ट फ्राइबल ऑर्गन. भगवान ने अगर हमको स्कल दिया है ब्रेन को बचाने के लिए तो किसी रीजन से दिया है. तो स्कल में जो ब्रेन जो है वो इस सीएसएफ में फ्लोट करता है. इट फ्लोट्स इन दिस सीएसएफ. तो ये अगर पानी एक्यूमुलेट हो जाता है ब्रेन में, वेंट्रिकल्स में, तो उसको हम हाइड्रोकेफलस कहते हैं. दैट कैन ऑल्सो गिव राइज टू हेडेक. ठीक है. अब मान लीजिए आपके जैसे एब्सिसेस हैं, कोई इन्फेक्शन हो गया, उसने अंदर एक फोड़ा बना दिया, जो कि आमतौर पे हिंदुस्तान में टीबी होती है, बट अलग भी हो सकते हैं. अदर ऑर्गेनिजम्स कैन ऑल्सो गिव यू ब्रेन एब्सिसेस. एब्सिस हो गए, या फिर किसी पेशेंट को फेशियल पेन है और उसमें ट्राइजमाइनल न्यूरैल्जिया है which is not responding to medications. That patient may need surgical procedures, you know. So it depends what is the reason for that headache. And similarly for spine, what is the reason for backache, what is the reason for numbness. अगर हो सकता है कोई ट्यूमर हो सकता है कोई स्लिप डिस्क हो जो नस को दबा रही है, जिसके कारण इंसान चल नहीं पा रहा है, या दर्द हो रहा है टांग में, या नमनेस हो रही है. So you need, not all slip discs need surgery, but there are few which need surgery also. So depending on the symptoms, depending on the radiology, depending on the electrophysiology, all these things we decide whether this is a medical case which we can handle medically or surgically. But there are many cases in which first we try and handle the case medically. If does not improve with medicines, then we think of surgeries. At the other spectrum, there are conditions like multiple sclerosis. उसमें सर्जरी का कोई रोल ही नहीं है.
ये क्या चीज होती है?
So you develop plaques, various plaques in the brain and at times in the spinal cord, and this is a progressive disorder. और पेशेंट को इसमें विजन लॉस भी हो सकता है, नमनेस भी हो सकती है, and there is, you can't cure this disease. We can give some symptomatic relief. कभी स्टीरॉइड्स देते हैं, बाकी और भी मेडिसिन हैं उनमें भी देते हैं. या गियन बारे हो गया, गियन बारे में आपका एक एफ्लिक्शन हुआ, उसके कारण आपकी वीकनेस हो गई, उनमें कोई सर्जरी का रोल ही नहीं है. तो बेस्ड ऑन
Are we
पेशेंट्स,
referring this as uncurable diseases? जो क्योर नहीं हो सकते हैं?
uncurable. MS you can't cure.
Okay.
Like then there are some things like which have both roles, medicine as well as surgery. You must have heard of Parkinsonism.
Correct.
So there is a medical treatment and there is a surgical treatment. Now there's a big debate as to when do we opt for surgeries. So the beauty of medicine is that it's constantly changing, it's improving, and I think medicine has given a lot of additional things to us, the human beings. It has added much more to life, because if you see in the yesteryears when we got independent, the average, the survival for humans was, for Indians, was somewhere around 40s, 42 and 45 for male and female. Today we stand at 75 plus, 70 plus, which is great. So I'm not saying it's all medicine. It's a healthier lifestyle, better hygiene, sanitation, lot many things, but there are many things which medicine has also given you. Heart attack से आज कितने लोग, you do an angioplasty and you're good. पुराने जमाने में पता ही नहीं चलता था, सब बोलते थे कि हार्ट अटैक हुआ और चला गया, सोते में चला गया. But now, because of all these advances, we have added a lot.
So all these discomforts in the body, how do we investigate? How a neuroscience person would like to investigate all these discomforts?
देखिए, सबसे ज़्यादा important is to listen to the patient carefully.
Okay.
Consider there is an ex-person, he comes to me. To listen to what he is saying. So, हमारे शुरू में ही, right in the beginning of MBBS, we are told history taking. History taking is let the person come up with the problems he has. अगर headache है तो कैसा headache है, दिन के किस समय का headache है, headache के साथ क्या क्या चीज़ें हैं, अपने आप ठीक हो जाता है या आपको दवाई लेनी पड़ती है, कब से है, उसके ट्रिगर्स क्या हैं, धूप में बढ़ता है, चीज़ खाने से बढ़ता है, या मॉर्निंग में होता है, नाइट में ठीक हो जाता है, या इवनिंग में होता है, सुबह नहीं होता है, दे वेक अप फ्रेश, नींद कैसी आती है. हिस्ट्री टेकिंग इज द फर्स्ट थिंग. Then you examine. In examination, we have to cover everything. More focused on the CNS and the central nervous system and the peripheral nervous system. But anything, even a diabetic person can have a headache. So it's important कि आपको ये सब चीजें examine करनी चाहिए. Then investigation will have all the blood investigations, but more important from the neurosciences point of view are the radiological investigations like CT scans, MRIs, and then the electrophysiology like EEG and EMG, NCV, all these things, which tell us about the structural lesions as we see in the CTs and MRIs, and in EEGs we get to know about the brain activity कि अगर दौरे आ रहे हैं, फिट्स आ रहे हैं, तो किस एरिया से वो शुरू हो रहा है, किस एरिया से नहीं हो रहा है. देन ईएमजी एनसीवी आपकी मसल्स कैसी काम कर रही हैं, आपकी नसें कैसी काम कर रही हैं, ऑल दीज थिंग्स. सो दीज आर अ फ्यू थिंग्स which are routinely used and they contribute to management of the patient and
Okay.
diagnosis and management of
So
the
what
patient.
I understand from you is tech is helping a lot,
Oh,
right?
absolutely, absolutely, absolutely. You can't do without it.
Tech. So what are the new technical developments that are getting introduced in the market जो actually doctors को help कर रहे हैं and doctors are very happy with it?
Doctors are more than happy. जिन्होंने मेरे को न्यूरोसर्जरी सिखाई, उस समय at that time we didn't have CT scans. We didn't have MRIs available to us at All India Institute. They used to do angiographies or they used to do ventriculograms. In ventriculograms, you will put in a needle in the ventricle and then you'll inject some dye and you will see कि किस तरफ से shift है. It's an invasive procedure. Then you would guess कि हाँ भाई इस तरफ कुछ लीजन हो सकता है. अच्छा वो क्या है, ट्यूमर है या क्लॉट है या एब्सिस है, ट्यूमर भी है तो कौन सा है, कैंसरस है, नॉन, तुमको पता ही नहीं है. आज एक पेशेंट आता है और आप सीधा अगर बोलते हो कि ठीक है एमआरआई कराओ, कुछ है तो आपके सामने है, कुछ नहीं है तो आपके सामने नहीं है. मतलब you'll get to know if there is a lesion. If there is no lesion, you'll get to know there is no lesion. There are other reasons for the patient's problem. Then obviously MRI is a diagnostic tool. Ultimately, you need to, if there is a tumor, you need to take it out and send it for a biopsy, histopathological diagnosis to know exactly what it is. But it can guide you in more than 95% of the cases what the tumor is, what you need to do. So these are the advances. Then navigation. We have neuronavigation, in which consider there is a very deep-seated small tumor somewhere in the brain. You don't want to disturb the entire brain parenchyma going to trying, पूरा उसको dissect करके, or you don't want. So by stereotaxies, which are very small needles, you can just make a small hole in the skull and put in a needle and take a biopsy from there, rather than पूरा जिसको कहेंगे हम craniotomy करना या खोपड़ी खोलना and all those things. So this is something new. Neuronavigation, we can reach the tumor at a path which does not disturb the important structures in the brain without with minimizing the harm to the person. So this is something which is very new. Now we have intraoperative MRIs also. We can actually see how much tumor we have taken out. Then mappings, brain mappings, a whole lot of things that are coming up.
जैसे आप लोग ओपन करते हो उसका, then the whole brain is actually getting infected with the air, simple air that is around. So उसमें infection होने के, उस बंदे को कुछ भी effect होने का brain में कितने chances रहते हैं?
Minimal.
Okay.
All the OTs these days are modern OTs. They are modular OTs.
Okay.
They have the laminar airflows and all those things. All the instruments that we use are autoclaved. The skin is also properly prepared before we place an incision. I'm not saying that infections don't occur or they will not occur, but with the current advances, the current methodologies, the incidence of infection is very rare. Very rare. The surgeries are safe and very rewarding.
Nice. So people are actually getting benefit out of the surgeries.
Absolutely, absolutely.
Nice, nice.
There are many tumors, brain tumors we can cure. Benign brain tumors we can cure.
Okay. जो पहले के टाइम पे नहीं क्योर
पहले
करना
तो
इतना
पता ही
मुश्किल
नहीं चलता था, ना सीटी था ना एमआरआई था, कुछ भी नहीं था. अच्छा, इवन पीपल यूज्ड टू डू क्रेनियोटमी, इसकी एक तरफ खोला और देखा कि कुछ है कि नहीं है. आई एम टॉकिंग अबाउट वे बैक. देन अगर नहीं निकला तो उस तरफ हड्डी रखती, फिर दूसरी तरफ खोला कि इस तरफ तो नहीं है. बट आजकल तो हमारे पास इतने साधन हैं. You have all these machines and gadgets which not only tell us but they can even guide us and at times in real time.
So जैसे आप रियल टाइम की बात बता रहे हो, what I understand from the real time, a software is doing the mapping for you, right? So is AI working for you, and how is AI helpful to you?
AI is something very fascinating, and the important thing for us, not only the doctors, the neurosurgeons, and everybody, is the sooner you accept AI, the better it is for you. Yeah, as you would know, change is the only constant in nature. Everything changes. Me, you, and everything changes, and AI is bringing a whole lot of changes into the world, and which is very exciting. So how does AI help? It helps in diagnostication, early detection, planning for any treatment, whether surgical procedure. It guides us during surgery. It guides us even about the outcomes and in the rehabilitation. And it's true not only, I can speak more for neurosciences, it's true not only for neurosurgical, but also for neurological diseases.
Okay.
You present a scan to AI, you present so many scans. So we have studies which are showing that AIs can detect tumors before a naked eye, a human eye, can detect tumors in the MRIs and in the CT scans.
And are these data sets relevant to the doctors? I mean, क्योंकि जितना हमने पढ़ा है and how we have learned about AI is, it is developed on the data sets that are being provided to it, right? A model is trained and then the model tells you that, this is happening, and detecting of the models, right? Detecting of the data sets. तो जैसे आप अगर वो किसी रिपोर्ट में मैप करके आपको बता रहा है, so can we trust the AI that it is actually giving the right reports?
It has to be something that a doctor works with the AI. You cannot take out either of. Obviously, we've been working without AI. It will try and analyze whatever you are asking it to analyze on the basis of those databases. If you present the wrong data to AI, to the algorithm, it will interpret in the wrong way. That is where the doctor comes. But there are studies and there are systematic reviews of AI where, as I told you, it can detect tumor before the naked eyes can develop. It can develop changes in Alzheimer's before we can detect changes in Alzheimer's. Then it can guide us in planning the surgeries. It can tell us what the outcomes is. But obviously there are challenges with AIs. So it's evolving, it's developing, it has already started helping us.
So when the AI is helping you to read the brain scans,
Yes.
is it faster than ever?
Consider there's a patient of stroke, ischemic stroke, where they are developing an infarct or a सूजिश आ रही है brain में, एक vessel block हो गया and all those things. Every second matters. If AI can give me, say, 10 seconds, and if a human takes around 10 minutes to find out, so every second matters. It depends how soon can you restore circulation in the brain and the changes may revert.
So डॉक्टर, जैसे आपने स्ट्रोक की बात करी, so these wearables in the market right now, right, watches and whatnot are coming and they are claiming that according to your sleep cycle we can detect actually your sleep cycle, we can save you from stroke, we can tell you if the accident has happened, and they would be calling an emergency number. Are these claims really real?
I think we are still to find out. It's very early for us to, kind of pass a judgment on to these. But what I would look at, I see them as tools for a healthier living. You know, we all know that we need in our sleep, we need five non-REMs and five REM sleep. Sleep is basically two types of sleep, a rapid eye movement and a non-rapid eye movement. For a good sleep, we need, five cycles of each. So in the REM, we have rapid eye movements. Eye हमारी हिलती हैं उसमें, non-REM में eyes नहीं हिलती.
It's like a deep sleep that we go?
Not a deep sleep, deep sleep. Yeah, so a non-rapid eye movement sleep is generally considered to be a deeper state. Today I sleep for around 6.5 to 7 hours. Even if I want, I can't sleep for 10 hours. My requirement is less. But for a baby, a newborn, उसको क्या करना है? उसको सोना है, उठ के रोना है, दूध पीना है और फिर से सो जाना है, because his requirement is more. A person who's young, requirement is more. That is why they sleep for around 10 hours. But in general, around 8 hours of sleep is good enough.
And why the sleep matters? I mean, जैसे आपने
Oh,
specific करा, right? अगर छोटा बच्चा है, उसे 14 या 12 घंटे 14 या आई थिंक 22 घंटे की नींद चाहिए होती है. As you grow, आपकी जो sleep होती है वो धीरे धीरे कम होती
yeah.
जाती है, and you don't need that much of sleep. Why is that so?
Well, that is so because firstly, the body's requirements also go down. All
Is
right.
it linked to the nervous system and the brain, how it functions?
So there's a circadian rhythm in the brain, day night variations and all those things, various substances like dopamines, endorphins and this and that all being secreted and all those things. So they are the ones that regulate your sleep wake cycle and all those things. You may or may not have noticed, अगर आप एक पेशेंट को आईसीयू में आप रख दीजिए, अब आईसीयू में क्या है, अब आईसीयू में तो 24 घंटे दिन है, बत्तियां जल रही हैं, आप सिक नहीं हो तो दूसरा वाला सिक है, तीसरा वाला सिक है, they lose a sense of when it is day and when it is night. तो उनको आप उससे अगर बाहर निकालोगे, once they shift to the room, उनके relatives हमसे बोलते हैं सर ये तो सोते ही नहीं है, ये दिन में सो रहे हैं और रात को जग रहे हैं और हमको नींद नहीं आ रही उसके वजह से. So क्या there is a circadian rhythm.
Okay.
भगवान ने दिन रात बनाए हैं. The brain also functions according to that. That is why so many
Is it the
patients.
same like jet lags happen for
Yeah.
people?
Yeah, in a way. Yeah. So when people in their 20s and all those things, when they come to me and they say we are having headaches and and all those things, the first thing I ask them is, what is your job? What kind of job are you in? So some of them are in call centers, some of them are working at night because they're working for US companies or whatever. They may come out with n number of excuses. When you're young and for some time your body will accommodate. But continuously over a long period of time, if you're fighting nature, if you're fighting the natural rhythm of the body, it will break down at some point in time. And it will break down in what way? You'll have fatigue, you'll have heaviness, fogginess, you'll not be energetic, and it's not possible like some people say Einstein used to sleep for 1 hour in 24 hours. Everybody is not Einstein. So there are individual variations also in the requirements of sleep. Like I sleep today for 6 hours, and when I get up in the morning, I feel fresh. So I need those 6 hours. But for another person, they may be needing 8 hours.
So, doctor, scientifically, what is going on the parameters which differs from body to body and it differs from the sleep time. So a person, like you said, Einstein just took 1 hour to sleep and he was like working.
Well, I didn't know
great.
him, but that's what he said.
Then I understand that. But I
Yeah.
would like to understand scientifically what is different with the brains of different people. And even if we exclude Einstein, he was a gifted person. So some of my friends just sleep for 4 hours. Or if we talk about some of the jobs like investment banking, people say people are working for 21, 22 hours. They are just sleeping for 2 hours and they are good to go. Their brain is functioning fine. They are coming up with ideas. So they are fresh. People who are sleeping like 10 hours, 12 hours, they are not feeling that fresh. So is this something which are chemicals secreted by the brain and it differs?
I think a lot of factors influence your sleep, especially these days. More than the chemicals and the hypothalamus and the pineal gland and all those things coming into play, it is the social, the psychological factors that are impacting our sleep these days. That is how I see it. Because I have many patients coming to me, they don't wake up fresh. So, as you said, some people sleep for 2 or 3 hours and they wake up fresh and all. Yes, you can do it. You can do it for 1 week, you can do it for 1 year, you can do it for 2 years, 3 years, but ultimately the body, it will take its toll on the body. You need a proper rest. As I told you, unless you have 5 good cycles of both the sleeps, except barring a few which are limited, you can't sustain it.
So 5 good cycles, when you say it's like 5 times a month in 30 days you should sleep well, or it is
No, 5 cycles of REM and NREM. They alternate.
Okay.
An REM cycle, an REM cycle, REM cycle, and REM in your sleep, in the regular sleep.
And how much time they did they?
Around 7 hours for 5 cycles of each, 7 to 8 hours. So that is why you may have read, generally they say around 8 hours of sleep is good sleep.
Okay.
So what I tell many people, look, God has given you 24 hours in a day. If you needed more hours, God would have given you more hours. He would have made it 30. So firstly, to every person who says I'm busy, I say you're not busy. You are poorly organized. You don't know how to organize your day. That's number one. So as I see it, and what I do is I try and divide my day in three parts. 8 hours of working, 8 hours of sleep and resting, and 8 hours of other activities. And each activity has an important role to play in your life. So if you wake up fresh and you're sleeping around 6 to 7 hours, it's fine. Then your body can sustain. But when in those times when you are very driven, एड्रीनलिन है आपका, इट्स पंपिंग यू, आप 2-3 घंटे, हमने भी करे एग्जाम्स दिए, 3 घंटे सो के अपना जाके फिर एग्जाम दिया है, फिर आके सो गए 15 घंटे, फिर उठे अगले एग्जाम के लिए, फिर से पढ़ना शुरू करा, बट यू कांट सस्टेन इट फॉर लॉन्ग टाइम. अल्टीमेटली द बॉडी गिव्स वे. That is what I'm trying to impress. Now, you mentioned about these gadgets, the watches and all those things, the headbands and all that. Good. I think they should be used for, you have to use them in the proper way. Don't get entirely dependent on it. Not every atrial fibrillation leads to a stroke. Not every atrial fibrillation has to be reported. So लोगों का क्या है कि यार मेरे को ना 8 घंटे की नींद लेनी है. That itself is a psychological trauma on. यार मैं सिर्फ 6 घंटे सोया हूँ, या मेरी तो पल्स अभी 110 चल रही है. There are a lot of factors. आपकी एंजाइटी से भी पल्स बढ़ सकती है, ठीक है, आप भाग रहे हैं या कुछ कर रहे हैं, उससे पल्स बढ़ सकती है. मतलब डोंट गेट टू फिक्सेटेड ऑन दोस.
But these headbands, the VR headsets that are there right now, are actually said that they are very helpful for the rehab and brain stroke patients who had their brain surgeries. Is it true in any manner?
Look, VR virtual reality headsets, what I know of is they have been used in training of neurosurgeons also. Plus, yes, they can detect the connections and activities. They can guide us towards rehabilitation in the stroke patients. As like I told you, the functional mapping of the brain and all those things, that is also being used as to which area of the brain is now starting to recover. So I think we mentioned, you asked me about functional MRI and all those things. But that detects the changes between basically it's dependent on the deoxygenated and oxygenated hemoglobin and all those things, So that can help us out. It can map the brain. आपने उंगली हिलाई, इधर brain में activity हुई. It can help that. The same way, it can kind of guide us, and it can give us an indication there is something which is coming up. The patient is on course of rehabilitation, is going to pick up this activity and all those things.
Is it also helpful in the coma patients which are there?
Yeah, so that is what. So it can guide us, and the studies are still there. Some are contributory, some are not contributory.
Because I have heard in coma, I mean, it's very difficult for a doctor to retrieve a person back, and with these gadgets, it is like case studies are coming that in lakhs, one person they are able to retrieve back with these headsets and functioning of these headsets and reading the data sets. So is it true? Somewhere, I mean, something is happening.
Look, one of the most important things for science is for you to prove. You have to demonstrate that it works, and not just once, repetitively. And that is when it is called as science. If it is once, it is faith.
Okay. So it could also be
that is where the distinction is. Yeah. So, once is a faith, a miracle, and all those things. Science is reproducible and repetitive. सूरज सुबह उगता है, वो रोज उगता है. किस लिए उगता है, क्या उगता है, and all those things. If you are fusing an atom with something, so every time it leads to some particular, it has to be repetitive. Obviously, variations, permutations, combinations, etc. can be there. But for it to be called science, it should be demonstrable, it should be reproducible, it should be repetitive. So once we have that, we'll call it science, and we are doing it. Before that, I think it's
So,
imagining a
I
bit
mean,
too
have
much.
you seen any of the
Somebody just got
cases?
lucky.
Any
Oh,
of the
I
cases
have,
in your
I think every
practicing?
doctor has
Yeah,
seen.
a miracle, like, this
Yes,
is, but this was
yes,
something which was not expected, and this is beyond science.
yes. We have all seen all the
Can you
doctors.
share?
Yeah. So, look, our understanding of human body may still be limited. I'm not saying we have understood nothing, but I think there are larger, more frontiers for us to explore. And I'm sure coming generations are going to add to our understanding and knowledge of medicine and human body and make us wiser. But I have had patients whom I thought are not going to survive. Patients with fixed dilated pupils,
Fixed
with
dilated pupils, as in?
so it's one of the signs that the person is about to go. Generally, when we shine a torch or light into our eyes, there is a cornea, this black one, और उसके बीच में एक aperture होता है जिसको हम pupil कहते हैं, जिससे light अंदर जाती है, it
Correct,
hits the lens and then the
correct,
retina and all those things. So generally, if a person has non-reacting pupils and of a larger size than the normal, we generally say कि very slim chances of recovery and all those things. But I have had patients whom I treated surgically, non-surgically, they improved, they even walked, but not all. But yeah, they were there. So there are times when you think, यार ये तो कुछ नहीं हो पाएगा, but patients do well. And there are times when you think, कि, boss, I've done the best surgery, I've given the best treatment, this patient has to survive, this patient will do well, but they don't do so well. It can play both ways. So, as I tell many people in medicine, and it's not just neurosurgery, but more so in neurosurgery, 2 plus 2 can be 40, can be 4, can be minus 40 also. It's not always.
so much
Medicine is,
variations.
yeah,
All right.
that's what human beings are. Everybody is different. How they respond to your treatment is different. How a doctor analyzes an individual patient can be different. But I can consider there is a patient X who comes to me with a slip disc. I can say surgery चाहिए. दूसरे डॉक्टर के पास जाएगा वो कह सकता है कि तुमको मेडिसिन चाहिए. Both are right and both can be wrong.
All right. That's why the doctor's consultation is also different when we go hop on to one doctor.
Yes, and each one of them is right. Look, this is not. But I'm a big fan of math. So math में but still, human body is something which is very complex. So it's not कि every disc needs surgery or every disc can be treated with medicines or every doctor is right all the time. If I say I have been right, I have given the right treatment, but I have always tried and given the treatment according to my knowledge and if I can say wisdom. But that has been right always, then I think any person who says that is not doing telling the right thing. Well, everybody makes mistakes, but it should not be negligence. Mistake is different, negligence is different. As far as you are practicing medicine, evidence based medicine, to the best of your ability, to the best of your knowledge, you are right in doing what you're doing. So miracles happen, they do happen. At times, the patients which I think are not going to survive, they survive. And in patients in which I think, man, I've done a good surgery, but they don't do so well. So it can happen.
And what has been your last 5 to 10 years? What has been your personal favorite innovation in the neurosciences?
Well, I think as we've discussed, the integration of AI into medicine and neurosurgery and neurosciences, the way it's going to shape up and the way it's going to benefit the physicians, the doctors, as well as the patient is something that I am kind of presently focused on, looking forward to, and excited about. So, this is what I would like to say. Yeah.
So, what are your thoughts on that? This new buzz that is being coming launched by Elon Musk, the Neuralink. What are your thoughts on it? I mean, of course, the studies are still going on. Do you see this chip can be functional if done correct?
Firstly, I would say I hope that Elon Musk doesn't see this. Now, coming back to Neuralink, it is approved by the FDA for human trials, but it is still not approved as a treatment. It is very promising. And I think and hope that this thing is going to revolutionize the treatment of the patients. Like if you make somebody, like you put a chip on the Broca's or Wernicke's area and you make them speak or understand what they are spoken to, or you can make a person move the leg which he's not been able to move just by putting a chip onto the brain. You may have seen patients with Parkinsonism. They have tremors by the placements of small electrodes into the brain. And then in those electrodes, there is a wire that goes onto a battery which is placed here. We give impulses and it can take care of their symptoms, dystonias, tremors. Depending on the predominant symptoms, there are various locations. So that is electrical. And it is repeatable. You can modify. अगर ज़्यादा impulses पड़ रही हैं, उसको काम नहीं हो रहा है, तो impulses कम करनी है, आपको बाहर से आप program कर सकते हो. So I think it is on the similar concept, on the circuits in the brain, on the neural connections and all those things.
Are these
So
circuits also have a server like a normal chips? Those have servers in place, and the servers' data are stored, and they are actually guiding it. So it can also turn into a disaster, right? If you're putting a chip
yeah.
in some person and it is linked to a server, and the server is actually not behaving as it should,
So that
can
is,
it turn to a disaster?
it can. Look, but medicine has never, there have been sacrifices for the gains that we have made. There have been sacrifices. So there have been methodologies or treatments or medicines that have been tried, and they have not done the desired thing. Rather, they have had too many contraindications, side effects or bad effects, and they had to be pulled off. There have been surgeries which have been like this, but that is what it is. Nothing comes without a price.
When you talk about gifted, more scientifically, I would like
Hmm.
to understand, is some of the brain part functioning more than the other person, or what we call in science as neurodiverse? Are these guys, how they are neurodiverse and we are like neurotypical people? Why is the brain not functioning with the same manner? Are they using a part of the brain which is more functional or more active, I can say, in those people?
I would say in a way, that's a wrong way to look at people. I would like to go towards it. Each one of us has some or the other gift. Some people realize what they're gifted at, some people don't realize what they're gifted at. So, this is what it is. So, somebody is a true academician, somebody is a fantastic guitarist. So he is gifted in academics, he is gifted in being a guitarist. The right side, the left side, the brain and all those things. किसी में हम बोल देते हैं इसमें ये ज़्यादा hyper functioning है, इसमें ये ज़्यादा hyper functioning है. Gifted we all are. We need to realize the gifts that we have been endowed with, and then we need to make use of them wisely.
Okay, okay. Is there also something which actually plays, you can correct me if I'm wrong, but what I have read is there is a bigger part of the brain, that is the upper part, and there's a lower part of the brain. The lower part of the brain actually functions very academically, like, or not academically, actually, very normally, like, you have to eat, you have to sleep, and the bigger portion of the brain actually tells you ethically what is right.
No, brain truly has been divided into a supratentorial
Correct.
and an infratentorial. This is anatomy. Most of the functioning of the brain is in the supratentorial, which is considered to be there is a tent, just like tents. There is a fascia like this, जिसके ऊपर ब्रेन का एक हिस्सा है और जिसके नीचे एक ब्रेन का हिस्सा है. ऊपर वाला ब्रेन जो होता है वो बड़ा हिस्सा है, नीचे वाला ब्रेन जो होता है वो छोटा हिस्सा. Most of the functions like eating, walking, sensory functions, speech, etc., and all those, the calculations, music, the remembrance, the memory, etc., they are governed by the upper brain. जो नीचे वाला हिस्सा है, that is primarily it functions on the imbalance. आपके खड़े होना, बैलेंस से चलना, स्वे नहीं करना, एक साइड गिरना नहीं, etc., and all those things उसके है. But there is another thing which is known as the brainstem, which is sitting right in front of the lower portion, which houses the centers for all the things practically, and all the nerves, etc., they go via the brain cell, the smaller structure. Respiratory center, cardiovascular center, सब चीजें वहां पर हैं. This is the anatomically how we divide the brain.
Okay, okay. So, Dhruv, now we'll be starting with the fun part of the podcast,
I'm looking
which
forward to it. Yeah.
is games of future and fiction. So with the sci-fi movies coming in, and we have been watching it for so long time, okay, there are a lot of things that are shown, and I as a viewer, or a lot of people as a viewer, we cannot really segregate that will this happen in future, or this is not actually making any sense to us. At least for that time,
Not
it does not.
realistic.
Yes, not realistic to us. So a headset that can record your dreams and play them back like a movie.
Futuristic.
Futuristic. Okay. A brain implant that lets you download a new language instantly.
Futuristic and exciting.
Okay. An AI tool that can detect depression even before you feel it.
Futuristic. I think I
You
want
have to be
everything.
rapid. You have to be rapid. You're taking too much time.
So futuristic, and which is the other one?
Future or fiction.
Fiction. No, futuristic.
Okay. A smartwatch that can predict seizure minutes before it happens.
Futuristic.
Okay. A pill that gives your brain super memory like a hardware upgrade.
No. And that's
That's a fiction?
Fiction, yeah.
Okay. Robots performing 100% of brain surgeries with zero error.
Fiction.
Okay. A device that lets two people send thoughts directly to each other.
Futuristic.
Okay. An app that shows your brain stress levels in real time.
Futuristic.
Okay. Virtual reality therapy that helps strokes patients walk again and faster.
Futuristic.
Okay. Brain stimulation that instantly cures depression and anxiety.
Futuristic. Very much. Can I
Yeah,
elaborate
yeah,
on
sure.
that? We talked about DBS in
Yeah.
Parkinsonism. It has been tried in depression also.
Okay.
Yeah. So that's a stimulation of the brain
Mm-hmm.
which can help in depression. It has been tried, and I think in future we'll see it coming up.
AI that creates a personalized Alzheimer's treatment plan.
Futuristic.
A chip that can erase bad memories without harming your brain.
Fiction.
Okay. Brain computer interfaces that lets paralyzed people control phones and wheelchair with thoughts.
Futuristic.
Okay. A blood test that can predict if you will get Parkinson decades early.
Futuristic.
Okay. A headset that lets gamers control video games using their brain waves.
Fiction.
Okay. That's it for the segment.
Oh, that
I
was
believe
lovely.
a lot of things were futuristic, and we can see a lot of things coming in near future. We
Well,
can expect actually.
I'm an eternal optimist. So I want everything good to happen.
Nice.
And why did I say to erase the bad memories as fiction? Because uh, bad memories are generally failures and
Mm-hmm.
all those things, and they teach you a lot. So if
Mm-hmm.
you forget those bad memories and those failures, you'll lose those teachings also. So I think life is a mix
True.
of good things and bad things, good memories and bad memories. So my take on life is that it's the memories that you create in the moments that you live. So that is what is life. So memories should be both ways.
True, true. Now let's move to the next segment.
Sure.
That is Neurotech Tinder. So Tinder in general talks about dating and right swipes and left swipes. Let's see what are the texts that you right swipe or left swipe. So left swipe is you're rejecting it. Right swipe is like you're accepting it and you're saying it's doing great to the neurosciences.
All right.
Okay.
Yeah.
So the first option, EEG caps. Right
Right
swipe,
swipe.
left swipe. Right swipe.
I
It's
would
good.
like that to happen.
Yeah.
Yeah.
So right swipe.
Right swipe. Yeah.
Okay. Brain chips.
Right swipe.
VR rehab.
Right swipe.
AI diagnostic dementia.
Right swipe.
You're
I
doing
think
everything right swipe.
I told you I'm an eternal optimist. I want everything to happen, and I believe that everything will happen. Yeah. Why not?
Nice, 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 nice. So that's it.
That doesn't go that I'm gonna date every Tinder.
So that is a great Tinder game that you played. Now let's move to the next segment of our show,
Yeah.
which is a myth and a fact game. So
Myth.
some statements that I say can be a myth. Some statements I say that can be a fact. You can
Yes.
just define which is a myth and which is the fact that is prevailing in the market.
Sure.
Okay. So the first case, AI can read your thoughts.
Myth.
AI can detect a stroke faster than some doctors.
Fact.
AI will replace neurosurgeons completely.
Myth.
Wearables can detect brain hemorrhage.
Fact.
Sleep is a brain battery charger.
Fact.
Great. That's it. That's what the segment is. Thank you so much for coming, Doctor, and joining us in the podcast.
Well, I thank you and the entire team for having me over here. It was really a pleasurable experience.
I hope you all had a fun time and an informative session with Dr. Dhruv. Thank you, Doctor.
Thanks a lot to you too.